Good day, I am Sherwin Jamie Orada together with my colleagues.
I am Yashmin C. Maulana.
I am Nicole Alayvar.
And I am Abdul Samad Masorong. We are junior clerks from Matias H. Aznar Memorial College of Medicine.
For today, we will be performing the Essential Intrapartum Newborn Care or EINC. EINC is a package of evidence-based practices of time-bound, chronologically ordered standard of care in all births by skilled attendants. EINC is composed of 4 core steps: immediate thorough drying of the baby, early skin-to-skin contact between the mother and the newborn, properly timed cord clamping, and non-separation of the mother and the baby for early breastfeeding initiation. And before starting with the procedure, check the temperature of the delivery room to be around 25 to 28 degrees Celsius, and then check the draft.
Then, prepare the equipment needed. Do the proper hand washing, and then don the gloves. Upon the delivery of the baby, proceed to call out the time of birth and gender.
Baby girl is out, time of birth, 10:36 a.m.
Use the first linen to towel dry the body of the newborn. Dry the baby for at least 30 seconds while observing for breathing. Remove all the wet linen. Initiate a skin-to-skin contact by placing the baby prone onto mother's abdomen or chest. This establishes mother and child bonding and minimizes the risk of sepsis and hypoglycemia. Cover with warm, dry blanket and place the bonnet on the newborn's head. Inject 10 IU of oxytocin to mother's arm after excluding the second baby. Clamp and cut cord between 1 to 3 minutes or when pulsation stops. Clamp cord at 2 cm with sterile cord and at 5 cm from the base. Cut close to the cord clamp. Properly timed cord clamping and cutting prevents anemia and hemorrhage. Keep the cord stump dry and open.
Palmar surface of one hand is placed on mother's abdomen over the uterus, gently but firmly pushing the uterus upwards and backwards. At the same time, steady but not too strong traction is applied on the umbilical cord in a direction that is downward and backward, and then only downwards till the placenta is expelled completely. The placenta is complete and has no abnormalities. Examine birth canal for bleeding and lacerations, and repair episiotomy if done. Remove gloves and discard properly.
Keep the baby in skin-to-skin contact with the mother until the baby completes first feed or at least 60 to 90 minutes. Watch for feeding cues at 20 to 90 minutes and encourage breastfeeding once present. Encourage breastfeeding per demand. Room in baby together with the mother within 24 hours. Summarize findings and document.
Hello, good day. My name is Dean Philip B. Olivario, Junior Clerk from Maham College of Medicine. So today I will be performing episio, which is used to repair vaginal and perineal lacerations after the delivery of the fetus and placenta. Prior to procedure, make sure to do hand washing first.
Check good lighting and visualization. Do gloving for asepsis and antiseptic technique. Check if anesthesia given is effective. Properly identify the instrument and sutures on the Mayo table.
First, we will identify the structures involved. This block represents the female perineum. The top surface represents the posterior vaginal wall. This is the vaginal fascia and this is the hymenal ring. The front face of the block represents the perineum. This is the fourchette, the perineal skin, and this X is the anus. This is the second-degree laceration. If we try to retract it, we can visualize the perineum muscles. Lastly, we will identify the apex of the laceration. After numbing the area, the first set of suture that we will be using is the continuous interlocking. We will anchor the suture 1 cm above the apex of the vaginal laceration to prevent hematoma.
Close the vaginal mucosa and the underlying recto-vaginal fascia using interlocking absorbable suture up to the hymenal ring. Then identify the muscles of the perineal body. We approximate together the transverse perineal muscle. A transitional stitch will be done from the hymenal ring, then deep into the laceration, then come out from inside the laceration. Then make a stitch right across and come out of the blue dot, which is the perineal body. Then another suture will be done from the other perineal body all the way down near the rectum. Once we are done with the repair, inspect and ligate bleeders or any signs of hematoma.
Next is palpate uterine fundus if contracted. For asepsis and antisepsis, apply a palmful of product in a cupped hand. Rub the hands from palm to palm. Right palm over the left dorsum with interlaced fingers and vice versa. Back of fingers to the opposing palms with the fingers interlocked. Then rotational rubbing of the left thumb clasped in the right palm and vice versa. Once dry, your hands are safe. Next is perform recto-vaginal exam. And then remove gloves and discard properly. And lastly, document findings.